Heart murmur is an extra sound between the heartbeat, and a heart murmur can either occur while the heart is contracting or while the heart is relaxing. After babies are born, pediatricians evaluate all the children, listen to their heart, including evaluating their entire body, and if they hear a heart murmur or have concern, at that time they may be referred for further evaluation. And then as children see their pediatrician or primary care provider, at each well-child visit, the doctors will listen to their heart with a stethoscope. So at any point along the way, a heart murmur can be detected or picked up, and again, it's up to the primary care doctor, because many of these murmurs can be normal. If they think there may be a quality that sounds a little different than normal, then they may refer you for further evaluation.